NEET DM 2026 examinations, and so many students are appearing for the super specialty DM examinations. Now, coming across the previous year's questions, what types of questions we expect in the NEET DM 2026 examinations, I'll be taking you through the types of questions which are asked and how to prepare and how to arrive at the diagnosis. So, let's start about the questions which will be there as far as the DM examinations are concerned. Now, you have to remember that there are certain important latest concepts which are asked, and this question, let's start like this. The 3C syndrome has components except cranio, cerebello, cardiac, caudal. These types of latest concepts should be remembered by all the DM examinations because the standard of the examinations is high, and many students, I mean to say, do not get enough time to go through the latest concepts, the molecular, the genetic basis of the disease, the pathology, the physiology of the disease. That's very asked. I mean, say basics are asked sometimes. So, as far as the 3C syndrome is concerned, you are well aware of this entity, craniocerebellocardiac syndrome. So, you will be having cranial, I mean, say manifestations. Cerebellum will be included in the cranial and cardiac. As far as the craniofacial anomalies are concerned, we're well aware of the prominent occiput and the forehead, which is there, hypertelorism and ocular features like the ocular colobomas and the cleft palate, which is important from the cerebellar aspect. It is the cerebellar hypoplasia, especially the hypoplasia of the cerebellar vermis, which is a feature of the Dandy-Walker malformation as well. And the cardiac features are tetralogy, Fallot, ASDs, and VSDs. The important catch point from this question is that you have to know that these types of rarities are asked. They are frequently on the examiner's mind, and DM happens to be very competitive, very standard, with so many students appearing for, I mean, say, gastro, endocrinology, hematology, cardiology, and there's a lot of, I mean, say, competition in some of the branches rather than other branches like the genetics and infectious diseases, but somewhere in gastro, endocrinology, cardiology, neurology, there is a competition and you need to get the high merit and these questions right. So that's important. Now, very important, the rarities which are frequently on the examiner's mind, as I told you, in Downey syndrome, what would be the most likely feature? As far as this rarity is concerned, you know that it is a syndrome which is characterized by ovarian cysts. There are ovarian cysts which are present on the surface. The ovary is studded with the ovarian cysts, and there's atrophy of the muscles and failure of to thrive as far as these individuals are concerned. And there's a loss of subcutaneous fat with excessive body hair, an important endocrinological entity which is very frequently asked, like the other entities like the PCOS. And this Downey syndrome happens to be a rarer entity, but you have to remember that it is a combination of multiple ovarian cysts, and associated with that, there is the, I mean to say, atrophy of the muscles. So hypertrophy is not there, it is the atrophy of the muscles which you have to remember. Now, another endocrinology question which is asked is the septo-optic dysplasia. A patient presents to endocrinology clinic with septo-optic dysplasia. What are the features? So options are given A, B, C, D, a different range of options, different, I mean to say, trying to distract you from the main thing, but you have to remember simply what is septo-optic dysplasia. And septo-optic dysplasia is basically the absence of septum, and this septum pellucidum, which is a membrane-like structure present just in relation to the corpus callosum, and there is the optic nerve, and there is associated optic nerve dysplasia as well. And it is one clinical condition in which you have got a particular type of hypogonadism, and that is the hypogonadotrophic hypogonadism. So we have the absence of septum pellucidum, optic nerve hypoplasia or dysplasia with hypogonadic hypogonadism in association with diabetes insipidus. It is not the diabetes mellitus, it is the diabetes insipidus. So there will be a distraction sometimes given in the form of diabetes mellitus. So you have to remember those important hypogonadotrophic syndromes. Hypogonadism is a feature of which syndromic entities, which clinical entities, and that's very important from an endocrinological perspective. Now, basics molecular, I was emphasizing at the onset, CT, NNB1, and APC mutations are common in which say conscience. The options given are desmoids, melanomas, GIST tumors, and synovial sarcomas. So these are benign or malignant conscience which are given there, and you have to remember which is the say mutation which is associated. So as far as CTNNB1 and APC is concerned, you are well aware of desmoid tumors, which are musculoepineurotic benign abdominal wall tumors. Say not that common, but you have to remember that they are associated with an important polyposis syndromic entity, which is the Gardner syndrome. And you have to remember the baseline mutations are concerned as far as different malignancies are concerned. So you have to remember Lee-Froman syndrome. You have to remember the mutations, P53 gene mutations. You have to remember other types of chromosomal aberrations which occur, which chromosome is associated with which clinical entity. So in this case, CTNNB1 and APC mutations are common in desmoid tumors. Other options are not, say, near to the correct answer. Now, as far as the questions are concerned, another question, the antibodies, namely CD99 and MIC2, are elevated in a group of patients. So they have evaluated a group of patients, and those group of patients, they have found the antibodies CD99 and MIC2. They are usually associated with sarcoma, melanoma, keratocanthoma, and myeloma. We're well aware of this orthopedic condition, which is the Ewing sarcoma. The examiner has been a bit harsh because he has not given a proper entity, Ewing sarcoma. Ewing sarcoma is a diaphyseal bone tumor which arises from special cells, and it is having the features characteristic of osteomyelitis, fever, inflammation, high ESR. But as far as this question is concerned, he has not given these features. CD99 and MIC2 are very important markers of sarcoma, the Ewing sarcoma, which is a bone tumor and usually present in long bones in young individuals. So it is present in a almost adolescence to adult age group with the features of these things. So you have to remember the basic pathology as far as general medicine, as far as medical oncology is concerned, and these are the types of questions you are asked. Now, sometimes they ask you questions based on the prevalence, incidence of certain tumors, which are important. So, as far as this question is concerned, infantile hemangioendothelioma comprise -% of pediatric liver tumors. So, the options are there. So, you have to remember infantile hemangioendotheliomas are not there that rare tumors. They are common entities and they are common benign hepatic tumors, especially of the childhood age group. And they are usually present in the liver, and skin and heart may also be associated. So you have to remember that the compromise of the 10 to 15% of pediatric liver tumors. The takeaway from this question is that you have to remember the incidence, the prevalence, the of certain important conditions, how much the particular condition is prevalent in which geographic area, what are the geographic areas which are associated. Say certain malignancies are common in the West, certain malignancies are common in the subcontinent, and you have to remember the relative incidence, prevalence, the morbidity, the mortality, the 5-year survivals, especially of certain tumors, important. We cannot remember all of them, but you have to remember that these types of questions are also asked. Now, again, biallelic mutations of TCF1 gene in a 35-year-old female with liver nodule would favor the suggest of liver cell cancer, hepatocellular cancer, hepatic adenoma, cholangiocarcinoma, and none of the above. Now, as far as hepatic adenoma is concerned, your knowledge by now, DM, very competitive. These are basic questions, and you should be able to answer that. It is a benign and non-malignant tumor of the liver and occurs exclusively in females in the 30s and 40s, third and fourth decade, and associated with oral contraceptive use. And sometimes they may bleed and rupture. But you have to remember the basic question of whether biallelic mutations of TCF gene are seen in more than 50%, more than half of the females with this hepatic adenoma present with biallelic mutations of TCF1 gene. And that is very important in addition to other pathological features like a well circulated mass, which is usually a hepatic adenoma. That's important. Now, tumors in adults, and in the brackets it is given non-durable based with S100 positivity and which are well circumscribed, which are cystic and fatty generation is common within which tumor of the nervous system, schwannoma, medulloblastoma, glioblastoma, teratoma. So as far as these, say, tumors of the nervous system are concerned, meningioma, glioblastoma multiforme, the metastasis, the cerebral metastasis, and these are all different. Say meningioma, it's a dural-based tumor. It arises from the arachnoid, I would say, base cells. So you have the characteristics, I mean, some of our bodies associated with them. So that is how you classify meningiomas. As far as this question is concerned, you know schwannomas, they are usually benign along the course of the vestibulocochlear nerve and usually present at a particular anatomical surgical location. The cerebropontine angle pathologically, Antony A, Antony B areas, Verroque bodies, and S100 positivity is very important. And apart from that, the pathological features which can be commonly seen, the cystic and fatty degeneration, which are there. So this tumor is non-dural based with S100 positivity, and the correct answer would be schwannomas. Although the examiner has not given, as far as the DM standard is concerned, he has not given you the choices, other clues to this. So you have to remember that schwannomas are very important and very frequently on the minds of the examiner. There are certain important things on the minds of the examiner, the multiple endocrine neoplasia syndromes, the tuberous sclerosis, as far as oncology is concerned, as far as schwannomas are concerned, as far as meningiomas are concerned, glioblastoma multiforme, butterfly tumor, very aggressive, lethal, very, I would say, poor prognosis. So pathological features of all these tumors you have to remember along with the baseline mutations wherever they exist. Now, a patient has got Kueger-Wellender's disease. So what type of a disease neurologically is the upper motor neuron disease, is a lower motor neuron disease? It affects the adult population, it affects the juvenile population. Is it heredity? Is it non-heredity? So in one sentence, all the confusing terms are given there. Juvenile heredity, LMN, adult heredity, UMN, non-heredity. So combination of factors. But the basic concept is there. It's a juvenile heredity lower motor neuron disease. So you have to remember that it appears between the ages of 3 to 15 years, 3 to 20 years of age, and affects girdle muscles first and the distal muscles. But it is a classic hereditary disorder. It's a classic lower motor neuron type of a disease, and it is present in the juvenile age group. So juvenile hereditary element disease, you have to remember. In Papa syndrome, which is not usually seen. So you have to remember these things. What are the features of certain clinical entities? So over here, you have to remember that this is Papa syndrome, and Papa refers to pyogenic arthritis, pyoderma gangrenosum, and hidradenitis suppurata. Hemorrhagic telangiectasias are not seen. Papa and Papa syndromes are distinct entities, and that will come as far as your next questions are concerned. But Papa syndrome is a rarer entity which is asked sometimes, and it is very, I mean, say on the examiner's mind, things like those. So remember that it is the hemorrhagic telangiectasis which is not a feature of this. The idea is to give you an idea about the standard of the DM examinations and what you have to remember about as far as the clinical features of certain diseases are concerned. So I think that by this set of questions, you come to know the level, the standard, what is asked, what are the option like types asked, and how to, I mean, say, basically it is, I mean, your fundamental knowledge, which helps you a lot. And as far as the DM examinations, they are tending, going, normally so many students appear now, more students appear than the previous examinations. The competition is increased, the chances of you getting questions wrong decreases, minimizes your percentile, and that's what is important. And in this, we have got the Platinum Pearls General Medicine Super Specialty book, Volume 1 and Volume 2, covering all the subjects which I just mentioned. I wish you best of luck for your examinations and for your preparation. Thanks a lot.